News 8 and Griffin Health are teaming up to help you learn how your body works, all for a healthy future. Here to talk about feminine health is urologist Dr. Grace Biggs of Griffin Hospital. Dr. Biggs, it's great to have you with us.
Thank you.
What is it about feminine health that you want women to know more about?
Well, it encompasses a lot, but as the director of pelvic health at Griffin Hospital, I wanted to focus on something that's a little taboo, even mysterious, which is a woman's vagina.
And vaginal health.
Vaginal health,
about here.
Yes. People don't want to talk about it because it is mysterious and something we just don't talk about openly.
They don't even like to talk about it amongst their other friends or girlfriends.
Exactly. And some women are brave enough that they bring up certain topics, but I wanted to highlight that it doesn't have to be a mystery. I think that if we gain knowledge, it allows us to make proactive, positive choices, which then allow us to improve quality of life.
So when a patient comes to you, are they generally still pretty shy to talk about it?
They are, but once the door closes, you'd be surprised at how quickly the information comes out.
Oh, that's a good thing. So what do you tell people? What is it that they're most concerned about when they come in?
Well, the topics vary and the concerns vary from different things like kidney stones and recurrent urinary tract infections to much more personal things like vaginal dryness, vaginal pain with intercourse, intimacy, not understanding the changes that their whole body is undergoing, and specifically their pelvic health and their vagina and their bladder.
And you offer all kinds of treatments. There's always a solution for most of these problems, right?
There are, and unfortunately, most women don't know about it because as medicine always advances, there's always new technology, new medicines, new strategies to help women improve their health.
So what's the #1 issue for most women?
Ooh, that's a tough
Would it be UTIs, urinary tract infections?
Urinary tract infections are very common, and it affects women from their teen years, even younger than that.
Exactly.
To well into their later life.
And treatment for that?
Really depends on the patient. So it is very multifactorial, lots of reasons that cause it. Sometimes it's drugs that they're taking, and sometimes it's environmental or social things that they're doing, like not drinking enough fluids, or something as simple as not urinating after having sexual intimacy. But it could be a lot more complicated, anatomical issues, menopause. So it's very variable.
And you treat that with antibiotics?
We try to limit antibiotics, but we use it certainly when it's appropriate. But we also use homeopathic methods, other options, social changes, and just habit changes. So there's lots of options. I want women to know that the antibiotics are not always the answer. Sometimes it definitely is.
Very good. Now for the older woman, let's say over 50, what's basically something they talk to you about?
Well, they admit that their sex life has changed because of the changes that are taking place in their vagina, and most of the time it's due to menopause. Sometimes it's drug interactions and things like that, but often it's due to the pure natural effect of getting older as a woman, entering into menopause, and having lots of changes take place due to the lack of estrogen.
And treatment for that?
There's lots of treatments for that, and there's local estrogen therapy. There's also pills that can be taken by mouth, but there's also a very new fascinating treatment which is called Mona Lisa laser therapy, and that allows the reversal of the changes that have taken place into the vagina back to premenopausal states that really bring back the health of the vagina to enjoy sexual intimacy again, but just to be comfortable and not have discomfort even when they're doing nothing sexually oriented, but just going about their daily lives.
So much to know about, Dr. Biggs. Thank you so much. And for more information, all you have to do is go to griffinhealth.org.